Okay, well, good afternoon, everyone, and welcome to our third and final session of our regulatory education series. So today we're going to be talking about scope of practice and does one size fit all? So we'll kind of answer that question today. So once again, my name's Kathy Arsenault, and I am the practice consultant for the Association of New Brunswick Licensed Practical Nurses. I'm just going to do a quick overview of the format of the webinar, as we do have a few people that are joining us today who weren't part of session 1 and 2. So the webinar is being recorded and it will be uploaded to our website so that others can watch at any time. Your microphones are going to remain muted throughout the presentation. However, if you do have questions or comments, you can type them into the Q&A box at the bottom of your screen. Once the presentation's over, we'll go through those question and answer period, but we won't be answering any questions until the end of the presentation. If you are having any difficulty hearing me, you can just try and adjust your audio settings, which can be found when you hover over the left-hand bottom corner of your screen. So if you haven't noticed, we have recently revised our scope of practice guideline, and that's been uploaded to our website, which of course is anblpn.ca. So in light of revising that document, we thought it would be good to provide a webinar on the topic for your scope of practice. And so certainly over the last 5 to 10 years, there's been a lot of changes to the LPN scope of practice, and sometimes that gets really confusing for people as to, what is it exactly that an LPN can and cannot do. And that, of course, it's not only confusing for LPNs themselves, but it's also confusing for employers. And I do think that the biggest confusion comes from these employer limitations through policies that may have not been revised in quite some time. And so therefore, there's just not always an awareness of what is actually within an LPN scope of practice in the province of New Brunswick. And this, of course, is where we often hear from people lamenting, and they call us and they say, well, why does ANBLPN keep expanding my scope of practice? But in actuality, the professional scope has not expanded in quite some time, in years actually, so we haven't expanded your scope of practice. It's the lifting of these older employer policies that is causing your personal scope of practice to change. So it might be something new that you're doing in your particular workplace, but it's actually been within your scope of practice for a number of years. So these are the kind of things that we're going to talk about in the webinar today to help kind of clear up some of that confusion for everyone. So I wanted to start today by just talking a little bit about the mandate of ANBLPN and our legislation and how this is tied to your scope of practice to lay a bit of foundation for you. So for starters, ANBLPN is legislated with the responsibility to regulate LPN practice in New Brunswick, and this is in accordance with the LPN Act. Our mandate has always been protection of the public, and we do this by promoting good practice, preventing poor practice, and then we intervene when practice has been found to be unacceptable. And we do these things as part of legislation, which of course is the law, and also in the name of patient safety, so that we can help ensure that the public is receiving that safe, competent, compassionate, and ethical care from all of our members. And so the nursing profession is one that is self-regulated. And so that means that the profession governs itself. So all LPNs are responsible for what they do, and we're responsible for what we don't do. So not only our actions, but our inactions as well. And our government allows our profession to be self-regulated by ensuring that we, as the regulatory body, set, monitor, and enforce those standards of practice and code of ethics, which of course are our core regulatory documents that we all have to be adhering to. And this is really an important point because I know that there's a certain population who don't always understand why we do things like a continuing competence program, for example, and they get really upset about it. And of course I know this because I bear the brunt of it because I handle the CCP, so I hear it all. But this CCP is part of legislation, it is the law, and it is part of us being self-regulated. So if the government ever came to us and said, Show us how your members are keeping up with their educational competencies, because it's written in your standards of practice and it's written in your code of ethics. We here at the regulatory body have to have a way of showing that our members are indeed participating, so that we can keep that privilege of self-regulating our own profession. And we don't want to lose that privilege of self-regulation. So if we were to fall short on those aspects, we run the risk of losing that privilege of self-regulation. And because we're self-regulated, it's every LPN's personal responsibility to adhere to those standards of practice and our code of ethics. So those are those core documents that guide our professional practice and what we're always going to be held accountable to. So now that we've laid a little bit of that foundation of our legislation and how it is we self-regulate, we can start talking about scope of practice and what does that all mean. So scope of practice is really just a general statement that refers to the activities that LPNs are authorized, educated, and competent to perform. And you'll hear me say these three words a lot throughout this presentation. Our scope is what's used to help guide curriculum development. So of course, what's being taught in the PN program. It's also really useful to refer to in the development of care models. So employers can use this to create safe staffing models and collaborate on care plans. And it also serves to help inform the public about the profession of practical nursing. The roots of our scope come from our entry-level competencies. And this is what we discussed at length in our second webinar that we did last week. But they also encompass competencies that go beyond entry level. And that's because an LPN scope of practice can constantly be evolving. And that's a really vital point, because it's important to realize that our scope of practice has that potential to constantly evolve based on any post-education that we acquire and the work experience that we build up over the years. So scope of practice is not something that remains static, and it's not going to be the same for everyone. And that's what we're going to talk more about as we move along. So here at ANBLPN, we often hear from employers asking for a specific list of tasks that LPNs are authorized to perform. But I'm here to tell you today that these lists do not exist, and they have not existed for many, many years. So since the 80s, we haven't had these task lists. And that's because nursing is a profession that can't be, it can't be defined by a checklist like a grocery list that you see. It evolves and it looks differently for everybody. And LPNs, of course, now have many shared competencies with registered nurses, which is another reason why these task lists don't exist anymore. And so rather than searching out this list of I can do this and I can't do that, we really want to be looking at scope of practice in its entirety. And that's what really makes the profession of nursing unique. So the Canadian Nurses Association has weighed in on scope of practice as well. And of course, LPNs can now be members of the Canadian Nurses Association. And they've stated that Canadians will be best served by our healthcare system when the legal and professional scope of practice encompasses the following. So they state that scope of practice needs to be broad enough to support flexibility and respond to our ever-changing healthcare needs. Scope should enable all nursing professionals to work to their full competencies. Your scope of practice should be free of any restrictions and promote role optimization. And it should also support intraprofessional collaboration among healthcare professionals. So LPN practice is really, there's kind of three components of your scope of practice. So you have your professional scope of practice, which kind of encompasses the other two parts. You have your individual scope of practice, and then you have your scope of employment. So all three of these are interrelated, and they can impact the LPN scope of practice differently. So this is, of course, why one size does not fit all when it comes to your scope of practice. The scope of a new graduate is not going to look the same of that of a more seasoned LPN. The scope of somebody who graduated in 2010 is not going to look the same as somebody who graduated in 2020. 2015. So we know that curriculum changes over the years. People gain different work experiences based on where they've been. So there's lots of different factors that are going to impact your own scope of practice. So I want to talk about each of these three components a little bit more in depth. So at the top of the circle there, you have that professional scope of practice. So what that is that it refers to the designated roles, functions, and activities that LPNs are educated and authorized to perform. So this, of course, is set by the LPN Act, and it sets the boundaries for all LPNs in New Brunswick. So our professional scope can only be changed when there's been a change in legislation. So we can't just flip a switch if we want something added to our professional scope. It's usually quite a long process. It has to go through legislation. So it's not something that can just happen overnight. Then we go down to our individual scope of practice. And this is what really represents each LPN differently. So it's based on each LPN's practice environment, their education, their experience, and the competencies that they possess. So it, of course, can be minimized or it can be expanded based on where they're working and what the employer policies are. And this is what we mean when we say that LPN practice is not static. It can constantly be evolving as LPNs move through their careers, they gain additional competencies in relation to where they're working. And then the bottom circle, which is your scope of employment, this is the one that can really have the biggest impact on an individual's scope of practice because it is defined by job descriptions and employer policies. So an LPN scope of employment can really vary greatly from employment setting to employment setting, and each LPN, of course, is expected to know what's expected of them in their current role. So our individual scope and our scope of employment, of course, cannot ever exceed that professional scope of practice. So that's what kind of encompasses all of it. So throughout our career, our scope of practice is going to expand to reflect any new knowledge that we've obtained and any work experience that we've gained. And so because nursing it's so broad, there's not one LPN who can be competent in all areas of nursing and perform all interventions that are within our professional scope. That would be impossible because nursing is so broad. So it's really up to every LPN to assess what their own level of competency is and know their individual scope of practice. So another area that's going to impact our scope of practice is, of course, our context of practice, which is just basically what we're talking about here is our practice environment. So it's going to be our practice context that plays that important role in determining some of those care assignments and the appropriate use of LPN practice for each work environment. So we know that LPNs work in a variety of environments. So whether you're working in acute care, long-term care, out in the community, all of these practice environments are going to impact your practice differently. And so that's why we really want to be looking at each care assignment through the lens of that three-factor framework. And we talk extensively about this three-factor framework in our document, LPNs and RNs Working Together. And of course, we did a webinar on that back in June. But I just want to touch base on that briefly here in relation to your scope of practice. So the three-factor framework really, it assists with determining those care assignments because it looks beyond that proverbial task list, it looks beyond titles, and it really zones in on whether or not the intervention is safe to perform in a specific practice environment. So it looks at things like the client's level of complexity, the LPN's competence, and of course your work environment. So not all interventions are appropriate for every practice environment because of some of the risks it might pose to a client. If you have a client that's highly complex, they're very unpredictable, and perhaps they're at a high risk for a negative outcome. So this in turn is going to impact our scope. And so, regardless of what our title is or what color our uniform is, we all need to be working in collaboration with one another to better meet the needs of our clients. So LPNs are autonomous practitioners, but we're also always working in collaboration with the healthcare team. And the autonomy of each LPN is going to vary based on a client's care needs and the practice environment that we're working in. So again, it often comes back to that three-factor framework that we just discussed. And because collaboration is so important, it really remains vital that employers support this collaboration through policies, resources, and procedures that are going to promote collaboration among the healthcare team. So just as the Canadian Nurses Association stated in their statement regarding scope of practice. And it's also important just to have a little note here that a graduate practical nurse, you often hear us refer to them as GPNs, their scope is in fact, it's consistent with that of an LPN. However, it's going to be very limited because they're new practitioners, right? And that's why they have to be working collaboratively and under the guidance of another LPN, an RN, or a nurse practitioner, as they're beginning to utilize their skills and gain their own work experience. So the only big difference in the scope for a GPN is that they cannot assume the charge role. So they have to be fully licensed before they can take on that role because of their limited experience. So that would just be too much pressure for a brand new grad to be like the go-to person in a facility when they haven't had that opportunity to start utilizing their skills and they don't really have any work experience yet. So we just state that they can't be in that charge role. And then on the flip side, a more experienced LPN may also have acquired some advanced competencies, and that of course can expand your scope of practice. So often these are interventions that may not have traditionally been part of an LPN scope, but because there were specific needs of an organization, these competencies can be added to an individual LPN's scope of practice as long as they've received the right education and the right training. So these sort of advanced competencies can be added to an individual scope of practice as long as you ensure that the LPNs receive the education and the clinical mentorship to perform the intervention. The intervention is supported by an employer policy, so we always want to make sure that we're being supported by our employer, that it is within that professional scope of the LPN, and most importantly, that the LPN is going to have the ability to attain and maintain the competency. So not just performing something once, but that it becomes a routine part of care so that they can maintain that competency and not something that they do once every 2 years. And if I think of examples of some of these advanced competencies, if I think of my own experience as an LPN, I think of things like phlebotomy and IV initiation. So when I was in school and first starting out in my career, these interventions were certainly not, it wasn't traditionally part of the role of the LPN like it is today. But of course, over time, that's been added into the practical nursing curriculum. And we see, many LPNs who work in nursing homes or community care or even the hospital are having LPNs perform this intervention quite regularly, whereas in the past that wouldn't have been done. So that might be an example that sounds familiar to you if you're more seasoned like myself. If we don't ever say old anymore, we say seasoned, which is great. So my next 2 slides here are to help you determine whether or not you should complete a specific nursing intervention. So as we said, your scope of practice is really going to be determined by your education, your individual competence, and authorization, meaning, you have there's an employer policy in place supporting that. So it really does remain crucial that we understand the difference between the scope of the profession versus your individual scope of practice, because that is going to vary from person to person. So the image that you see on the screen right now depicts that at the bottom with the green circle, we have our entry-level competencies. So these are the minimal expectations of all LPNs. So we all graduate with these entry-level competencies. Then the dark blue circle is the my scope of practice, and that's going to be different based on any post-education we may have taken, any advanced competencies we may have acquired, and the work experience that we've accumulated over the years. And then, of course, surrounding all of that, we have the scope of the profession. So just because something is within your professional scope does not mean that we all have the competence to perform that specific task. So what we did, and you'll see this in our in our guideline scope of practice is that we adapted this decision-making tool to kind of help LPNs and employers determine safe and authorized practice for LPNs. So this is based on legislation and regulation, the needs of the client, the competence of the LPN, and the practice environment. So if you're kind of sitting here today and you're thinking about a specific intervention that you're not really sure if you can or cannot do this, these are the three questions that you want to ask yourself. So I'll kind of explain how we move through this that you see on the screen. So your first question pertains to education. So you ask, did you learn how to perform this activity in your practical nursing program or as part of your continuing post-basic education? So if you can answer yes to that question, you're going to move down to the next level. If you answer no, you're going to stop and consult. So let's say we said yes. So then your second level is your competence. So you ask yourself, have you been able to attain and maintain your ability to carry out this nursing intervention safely? So if you've not performed something in over 10 years, you've not exactly maintained your ability. You know, best practice may have changed, a number of things could have changed. So if you say no to this, of course, you have to stop and consult. But if you answered yes, you go to that third and final level of authorization. Is the nursing intervention part of your professional scope of practice? And does your employer authorize this intervention? So this is where employer policy has so much impact on our practice, because it may very well be something that's within your professional scope, but maybe in where you're working, your employer is not allowing you to do that yet. So if the answer is no, we stop and consult. We always encourage LPNs to advocate for full scope of practice. So you can always try and have a meeting with management and kind of ask why this is not part of your scope and kind of work through that. But if you get yeses to all three, then you can proceed with that intervention. And one thing we want to say here as well is that if your employer is going to, if something becomes new to your workplace, but you've not done it before, because of maybe a past policy or something like that, you can't refuse the education and refuse to take on new skills. If this is a requirement of the role and your employer is offering you the education and clinical mentorship, you do need to accept that. You can't just refuse to take on new skills. So what I have for you right now is a chance for me to interact with you a little bit, is I'm going to give you three different scenarios for you to think about and kind of vote on whether or not somebody should proceed with the intervention. So the first scenario I have for you is that perhaps there's an LPN that's been working in a long-term care facility for 15 years, but they've recently taken a new job opportunity in acute care at the local hospital. So as the LPN begins their morning shift, they receive an order to insert a catheter on one of their patients. So the LPN remembers that they were taught the skill in their PN program and they performed it as a student. And this is a regular nursing task authorized to be performed by the LPNs in this particular practice environment. But this LPN's not performed this nursing task in well over 10 years because it wasn't a routine task performed in their previous employment role. So I'm just going to launch this poll question to you. So based on that information, should the LPN proceed with this nursing intervention? So you can just vote yes or no. I'll give you a few seconds to do that. A couple more people are answering. Okay, so I'm just going to share the results with you. So 94% of you said no, they should not proceed, and 6% said yes. So the answer is that no, they should not proceed because they haven't done this in over 10 years. They're probably going to need a little bit of support the first time before just going ahead and doing this. So what an LPN should do in this particular situation is to go back and review the procedure and policy, see if anything's changed, have someone who's more experienced in the skill come with them to assist them and mentor them through the procedure so that you can reattain that competency and add it to your personal scope of practice. So it's not saying that, no, you just can't ever do it because you haven't done it in 10 years. You just need to kind of brush up on that because you haven't maintained your ability to do it. Doesn't mean you can refuse to never do it because you haven't done it in so long, as we said earlier, but you just want somebody, review that procedure, have somebody go with you, things like that. So my second scenario for you is that if you have an LPN working in community nursing and they receive kind of their client list visits for the day, one of the client requires blood work. So the LPN graduated in 2005 prior to phlebotomy being part of the regular PN program, and they've not taken any post-basic education related to phlebotomy. The LPN has consulted with the regulatory body and determined that phlebotomy is within the provincial scope of practice for LPNs, and the employer does have a revised policy that's authorizing LPNs to perform this nursing intervention. So, sorry, technical difficulties. There we go. So, should the LPN proceed with this nursing intervention based on that information? So, we'll give you a few more seconds to answer that. Okay, so I'll share those results with you. So 88% of you said no, they should not proceed, and 12% of you said yes, they should proceed. So those who said no are correct because this is an education competency, right? So they've not ever received the education because it wasn't part of their curriculum, and we said that they didn't take any post-education. Therefore, they're not competent to do it because they've never done it before. So the only green light they had was that, yes, it's in their provincial scope, and yes, their employer would authorize LPNs to perform phlebotomy in this scenario. So that LPN, of course, should seek out some education to become competent in phlebotomy. So if you can do phlebotomy through employer-based education, I know that Horizon has a module that you can do. We used to have a workshop, but with COVID, we can't offer it these days. So lots of people have done phlebotomy through us. So we hope to one day reoffer that. But you do want to make sure that you acquire that education and competence before. You can't just go, whipping needles into people if you've not ever been trained or educated on how to do that. Okay, so my last little scenario for you before we start wrapping up is that if you have an LPN that's working at the hospital, one of their patients requires IV antibiotics to be hung to treat an infection. The LPN's been educated in IV therapy, and this was a routine intervention she performed in her previous employment roles. However, the LPN has been informed that the workplace policy does not allow LPNs to initiate IV antibiotics. So, should the LPN proceed with this nursing intervention? So I'll give you a few more seconds. Okay, and I'll share the results with you. So we finally got a consensus here that 100% said no, they should not proceed. And of course, that is the correct answer. So Ivy, this is a kind of a real life current example, I would say, that I've come across recently with some LPNs, is that, you initiating IV antibiotics, that is within your professional scope of practice. In this scenario, the LPN has been educated and they've done it before in a previous work environment. But in this particular workplace, the policy is not allowing them. So I know, just it's no secret, I guess, is an example would be that as far as I know, last I checked, Horizon is not allowing LPNs to initiate IV antibiotics, unless that's changed just recently. You guys can correct me in the Q&A if so. And so there was confusion because LPNs were saying, well, my regulatory body's saying it's okay, which of course we were, because it is within your scope. But if your workplace is saying, no, it's not okay here, we have to adhere to those workplace policies. So that might be one you see change in the future. I'm not sure. So that's just a couple of examples for you there. So hopefully that helped you a little bit. So as we're wrapping up today, there's just a few points that I hope you'll kind of take away with you from this presentation. So the big one is practice cannot be defined by a task list. So that list doesn't exist, and we want to be looking at scope in its entirety. Practice has the potential to constantly be evolving, so it does not remain static. We have to be able to respond to those changing healthcare needs and changes to these care delivery models. So therefore, our scope is going to change. So we can't refuse to have things added to our scope of practice. And then finally, all LPNs are accountable in knowing when they can work more autonomously or independently and when they need to be collaborating with others. So in this, again, it's going to vary from person to person and from practice environment to practice environment. So I do want to thank you all for joining me today, and I hope this, started to clear up some confusion you may have had regarding scope of practice. I've really enjoyed doing this education series. It's been kind of fun connecting with people once a week. So, we are planning to offer more webinars as we navigate through COVID. I know it's hard for you to get in any kind of education lately because there's no conferences or things happening these days. If you do have any questions or comments, I welcome you to just contact me directly. So my phone number's there and my email as well. I'm going to stop our presentation, or stop the recording of our presentation now, and then we can open it up for some Q&A, which you of course can just type into the box, and hopefully I can answer your questions. And I, again, just want to thank you for joining me today, and thank you for all the hard work you've been putting in throughout this pandemic. So if you're not sticking around for the Q&A, you can always just leave the meeting. And if you do have some questions or comments, then I'm happy to chat about them now. So I'm just going to stop our recording.